Hi, this is Dr. Vivek, and in today's video, I would like to share my views, my opinions about Ozempic. Ozempic is very famous nowadays. If anyone wants to reduce weight, they have a good option of using Ozempic. Does Ozempic works? Yes, it do. And as we all know, that actually Ozempic was made for diabetic patients, the people who have high blood sugar levels. Why? Because it helps to control blood sugar levels. So it is used in the treatment of diabetes. But people are using it to reduce weight, and it has fabulous results also. Before using Ozempic, just listen to this video and then decide. It's your call, it's your body. I will just share my opinions, and I will also share with you the opinions of my friends, my doctor friends who are using it in the treatment. So first, what Ozempic really does. Ozempic reduces the feel of hunger. So if a person will use Ozempic, then he is not going to be hungry and he is going to eat very less in compared to without Ozempic. Second, body starts using its fat faster, especially from the liver. Third, it also suppresses the hunger hormone, so you are not going to be hungry. So what all these things will do? If you will eat less, then the blood glucose level in your blood, it's not going to spike. But what's happening? You are less hungry. So you will be eating less calories. What will happen? You will go in caloric deficit. And this will help you in reducing weight. So that's why people are reducing weight, because they are not feeling hungry and it's very easy for them to go in caloric deficit. Second, your temptation for the food is going to subside. So the food that was very tasty for you, very tempting for you, you're not going to have that temptation. So you're not going to eat that food, those calories full food, those unhealthy food. So you will be eating very less food, and that too just for your health. Ozempic is a new drug and we don't have lots of studies on it. But my friends who are doctors and using Ozempic for the treatment of diabetic patient and other patients, they are telling that the worst side effect that they are seeing is depression. Yes, Ozempic is causing depression in people if it's used for a longer period of time. Means you used Ozempic to feel good. You were obese or you wanted to reduce weight so that you can feel good, you can enjoy that movement, you can enjoy your life. But you are getting the side effects and still you are not able to enjoy your life. You are feeling depressed, you are not feeling good. These are the side effects. This is the biggest. There are other side effects also coming. Those are bad effects on your pancreas, on your liver, and many more. But what I see the most concerning one is depression. So Ozempic is not burning the fat or just reducing the fat from your body. Ozempic is just helping you to go into caloric deficit. And by being in caloric deficit for a long period of time, you are losing weight. So my view on Ozempic is why you are trying to take shortcuts. So now let me share my views. For this, I have a question for you. How long you are planning to take Ozempic? If you are given access to Ozempic, how long you will take it? For a year, for 2 years, for 3 years, 4 years, 5 years? You have to stop somewhere, right? You will be having side effects. So you will be stopping using Ozempic. Now what will happen? As you will stop using Ozempic, again, you will go to the same place from where you have started. Why? Because you didn't work on yourself. You just took shortcut and you reduced your weight, but you didn't work on your habits, your regime, your lifestyle. And it's all the same. As you'll stop using Ozempic, all these things are going to come back. Make good habits, eat on time, sleep on time. This is the best way. The best way to be in caloric deficit is eating good food, is being more educated about calories, about food, so that you can be fit for whole of your life. It's not only about reducing 2-3 kgs or 5-10 kgs, 20-30 kgs of weight. It's about being fit for whole of our life. Okay, let's just imagine that today night some magic happened, and when you will wake up tomorrow morning, you are seeing yourself as the best version of yourself. You have the perfect body as you imagined. My question to you is what you're going to eat on that day. You'll say, I'll do exercises. Which exercises? I'll eat food. Which food? It's all about education. It's not only just about the results. So you have to educate yourself. You should know the right way to do exercises, stretching, yoga, anything, whichever you like, swimming, running. Should educate yourself about the food also, so that it's your habit. After losing weight also, you have to be fit for whole of your life. And in this journey, the most important thing is your habit, at what time you are eating, what you are eating. These things will determine your health. Even let's leave Ozempic. There are other ways to reduce weight. For example, people, they do operation and they put a ring into the food pipe. What happens? If there will be a ring kind of a structure in your food pipe, then You have to chew a lot, then only you can swallow anything, or you have to drink liquid diet. So what will happen with this? Either you'll chew a lot, so you will be less angry, and anyways, you will be eating less. So you will be in caloric deficit. So being in caloric deficit, you will lose weight. I have many patients from all over the world who have done this operation, and as they removed the ring, their weight bounced back. Why? Because again, the same story, they didn't work on their habits. Now, another operation I will tell you. In this operation, people, they cut their stomach. The size of the stomach, it becomes smaller. So when you eat, you don't have that big hunger because your stomach size is small. So you will feel full by eating less food. Again, it will be easier for you to be in caloric deficit in this situation. So you will lose weight. But our body is awesome. Our stomach, it stretches. You ate little more, then little more, then little more. What will happen? Slowly, the stomach will stretch, and again, you will be eating more calories, and again, your weight will increase. This has happened with many of the patients. I have heard this story during the consultation. So, you see, all of these operations, medicines, they all end up being in caloric deficit. This is the only way to lose weight or to be healthy for whole of our life. So why to do these adventures? It will be better for you to do a panchkarma every year. Make it a habit of detoxifying your body, doing service to your body by doing panchkarma every year, just once. It is going to help you a lot. And whole of the year, your food habits, your sleeping habits, your health habits, these things will determine your health. So this is the right ways to lose weight rather than using Ozempic. These are my views. When I say these things to people, then people say, oh, I will lose few kgs, 5-10 kgs, and then I will stop using, then I will maintain. It will be easier for me to maintain if once I lose. Nothing like this happens. Even if you'll use these things, any of the things that I have told you, and you lose weight, and as you'll come out of this, again, you haven't changed your habit. I'm damn sure you'll come back to the same weight or even more than from where you started. So don't do these things. This is my recommendations. I hope today's video will be helpful for you. I have tried my best. See you next video with a big smile. Up to the time, smile more, stay happy, stay healthy.